Hello, my name is Marie Zambrano, and I will be covering preeclampsia amongst pregnant adolescents in the United States. When I say pregnant adolescents, I am referring to pregnant women that are under the age of 20. Preeclampsia is a condition that typically occurs during the 20th week of pregnancy, and it's characterized by proteinuria, which is having abnormally high levels of protein in one's urine, edema, the swelling of the face or hands, sudden weight gain, and hypertension. Severe preeclampsia may lead to eclampsia, which are the seizures that may follow preeclampsia. HELP syndrome, which is characterized by hemolysis, elevated liver enzyme, and low platelet count. In the worst-case scenario, severe preeclampsia may lead to the death of either or both the mother and infant. The exact causes of preeclampsia are unknown. Here are some risk factors that I have listed out. One notable risk factor is nulliparity, and that is when a woman has never given birth or it's her first pregnancy. The other notable risk factor is women younger than 20 and older than 35. So earlier I mentioned that I am focusing on pregnant adolescents that are at a higher risk of developing preeclampsia. When they become pregnant at such a young age, they're probably experiencing the first pregnancy, and they're younger than 20, so those are already two risk factors, and that doesn't include any of the risk factors that I have listed here on this slide. Preeclampsia is difficult to prevent because the exact causes are known, but here are some preventive measures anyways. Calcium supplements and low aspirin doses are known to lead to a reduction in developing preeclampsia. Pregnant adolescents tend to be women of lower socioeconomic status, and compared to older women, these young pregnant women are less likely to seek prenatal care, and they're even more likely to have no care during their pregnancy. The insufficiency or lack of prenatal care is more likely to lead to undiagnosed preeclampsia. In addition, they are more likely to be unable to pay for their medical costs. So a pregnant adolescent may have preeclampsia, but she may not know it, and it may go undiagnosed because she doesn't go to regular prenatal appointments. So I suggested going to regular prenatal appointments and having routine screening. That would include having her blood pressure measured to see if she's developing hypertension. Also, required urinalysis for protein to see if she is developing, or if she has high levels of protein in her urine. If the symptoms appear or if they worsen, especially in a short amount of time, then the pregnant adolescent needs to talk to the physician to plan when to deliver the baby, because delivering the baby is the only treatment. And the longer a woman with preeclampsia has a fetus in her womb, the worse preeclampsia usually becomes. In order to minimize maternal mortality and morbidity, in addition to maximizing the growth of the fetus, physicians will usually recommend that the baby be delivered after 37 weeks for mild preeclampsia and after 34 weeks for severe preeclampsia. I also recommend close monitoring of the infant and mother after the delivery to see if there are any more complications. I wanted to go back to the slide. When I talk about my opinion, I think that preventing preeclampsia is definitely possible. It's definitely a joint effort, on the individual, the facilities, the clinics, and the community, because making an environment that encourages, regular prenatal appointments is so important, especially for these pregnant adolescents. We need to make those facilities more accessible. Also, you can see that there are a lot of risk factors that are involved in preeclampsia. So preventing preeclampsia definitely involves preventing and improving any of these risk factors, the histories of obesity, diabetes, kidney disease, especially if they run in the family, because those pregnant women those pregnant adolescents are at a higher risk for developing preeclampsia. The last point that I wanted to make is that every pregnancy should be a wanted pregnancy, but with pregnant adolescents, that may not be the case all the time. But we should definitely encourage these pregnant adolescents to really take care of their bodies, especially during their pregnancy, because they're at a higher risk for a lot of pregnancy complications, not even including preeclampsia, but preventing preeclampsia from developing is definitely possible. This is the end of my presentation. Thank you for listening.